Primary care shared decision making is so important, and my personal favorite way to do this is with the Mayo Clinic's decision aids. I love the Statin Choice Decision Aid. What you do is put in the patient's data in terms of their age, whether or not they have diabetes, their lipids, their blood pressure, etc. And what you get is this pictogram which shows them how many patients with demographic and information like them will have a heart attack in the next 10 years. And then there's a second pictogram that you can show patients, which is like this one, that shows how many patients, if they took, in this case, a high dose statin, would be saved or prevented from having a heart attack. These are these blue dots here. And then it also provides some information on cost, although this is obviously going to vary depending on the patient's insurance coverage. It goes through side effects, even other benefits, and it's just such a helpful thing to have up in the exam room with your patient as you're making these decisions together, because maybe patients will say, yeah, I want to decrease my risk by taking this medication, or they may say, no, I don't. It's actually not worth it to me. By the way, this is obviously for primary prevention. I'm not talking about secondary prevention, people who have already had a heart attack or a stroke and definitely need to take a statin to prevent recurrent events. Another decision aid I love from the Mayo Clinic is the depression decision aid, which lists out a bunch of different common antidepressants, SSRIs, SNRIs, TCAs, and goes through their effect on different domains that patients really care about. So this example here, you're seeing weight. You may see it cut off a little bit at the top, but this is how each of these medications may affect weight gain or loss. It also addresses sexual functioning, sleep, cost, and withdrawal symptoms if people stop. So these are incredibly helpful. I love teaching my residents about these, and I personally love to use them all the time. And there are more from the Mayo Clinic too. These aren't the only ones, so definitely worth checking out.